I was diagnosed with myeloma in the autumn of 2006, and I had, through early 2007, I had all the necessary haematology treatments, but I still had quite a bit of back pain. Before I was diagnosed with myeloma, I had terrible pain. I had to wear a corset, I could hardly move, I was in agony. In fact, when I went for my last consultation before the diagnosis, I couldn't get off the bed. I had to be helped off the bed to the point where the consultant said, well, we're not going to let you out of the hospital until we actually find out what's wrong with you. After the myeloma was diagnosed, the initial treatment was the chemotherapy with dexamethasone and other drugs. And then on Christmas Eve 2006, I was sent to another local hospital for radiotherapy, and I had some radiotherapy on my back, which did make a small improvement in the pain. I got a little bit of pain relief from that. But that first year, until I had the vertebroplasty, I was still in a degree of pain, and the vertebroplasty reduced it very substantially. I learned about it during the course of 2007. I went to a conference organised by Myeloma UK, which Professor Gishin from Hammersmith Hospital spoke about the procedure and demonstrated it on the screen in front of us. Basically, you have a local anaesthetic and a gentleman sticks a needle in through your back, which you don't feel, and pumps cement into the damaged vertebrae, which strengthen them up, and that relieves the pressure on the nerves and thereby relieves the pain. And I would say that the pain was reduced by 70 to 80% after about 6 weeks. It wasn't immediate. I was warned that it would not be immediate, and there was some relief immediately, but it gradually improved until, I say, 70 to 80% improvement after about 6 weeks. And that's the way it stood. And as far as I was concerned, that was as good as could be done. But during that year, I was still getting a little bit of pain, and my haematology consultant at Norfolk Hospital recommended that I go to Stanmore Orthopaedic, where they were developing a new procedure called kyphoplasty, which is similar, but they inject a balloon into your vertebrae before they do the injection. The consultant said yes, he could improve the situation with my pain after having a look through the scans, and the procedure took place about a year or 18 months after the vertebroplasty, and I have to say that did improve the pain considerably. I had damage on, I think, 3 vertebrae, which he dealt with. That is now about 7 or 8 years ago, and it's virtually 99% relief of pain. Before I had kyphoplasty, I was thinking of giving up golf, I had given up golf and was thinking of selling my golf clubs. After kyphoplasty, I now play golf quite regularly.